There is a condition that affects millions of people, often without pain, without warning, and without clear symptoms. It develops slowly over years, sometimes decades, and for many, the first visible sign is not a symptom, but a serious event. High blood pressure, or hypertension, is one of the most common health conditions in older adults. According to the World Health Organization, more than 1.2 billion people worldwide live with hypertension, and a significant portion are unaware of it. Among adults over the age of 60, the prevalence increases dramatically. In many cases, the body adapts quietly to rising pressure within the arteries, making it difficult to detect without measurement. But even when symptoms appear, they are often subtle, easily dismissed, or mistaken for normal aging. Historically, hypertension was less common, partly due to lower sodium intake, higher physical activity, and diets based on whole foods. Modern lifestyles have changed this pattern, leading to a steady rise in cases globally. What makes hypertension especially dangerous is not just its presence, but its silence, because by the time it becomes obvious, the damage may already be significant. Persistent headaches, pressure within the system. Headaches are among the most commonly reported symptoms associated with elevated blood pressure, yet they are also among the most frequently ignored. In many cases, these headaches are described as dull, persistent, and often located at the back of the head. They may occur more frequently in the morning, when blood pressure naturally rises as the body transitions from rest to activity. From a physiological perspective, increased pressure within blood vessels can affect circulation in the brain, leading to discomfort and tension. Research published in cardiovascular journals suggests that while mild hypertension may not always produce symptoms, more sustained or elevated levels can contribute to recurring headaches. Historically, before the widespread use of blood pressure monitoring devices, headaches were one of the few observable indicators that something might be wrong. However, because headaches can result from many causes, including stress, dehydration, or fatigue, they are often dismissed. For older adults, this creates a risk. What appears to be a minor, recurring discomfort may reflect an underlying increase in vascular pressure. Over time, this pressure can strain blood vessels, increasing the risk of more serious conditions such as stroke or vascular damage. Recognizing patterns, such as frequency and timing, becomes essential in understanding their significance. Shortness of breath, the heart under strain. Shortness of breath is another symptom that can develop gradually in individuals with high blood pressure. At first, it may appear only during physical activity, such as walking or climbing stairs, but over time it may begin to occur with less exertion. High blood pressure forces the heart to work harder to pump blood through the body. This increased workload can lead to changes in the heart structure and function, including thickening of the heart muscle. Research from the American Heart Association indicates that prolonged hypertension can contribute to heart failure, a condition in which the heart becomes less efficient at circulating blood. As a result, fluid may accumulate in the lungs, leading to difficulty breathing. Historically, shortness of breath was often associated primarily with lung conditions. However, modern research has clarified its strong connection to cardiovascular health. For older adults, this symptom is particularly important. Because it develops gradually, it may be attributed to aging, reduced fitness, or temporary fatigue. But when it becomes more frequent or occurs at rest, it may indicate that the cardiovascular system is under significant strain. Understanding this connection can help identify early warning signs before more severe complications develop. dizziness and balance issues, reduced blood flow stability, dizziness and balance disturbances are often overlooked as signs of blood pressure irregularities. These symptoms may present as lightheadedness, a feeling of instability, or brief episodes of disorientation. From a physiological standpoint, blood pressure plays a critical role in maintaining consistent blood flow to the brain. When pressure is too high or fluctuates significantly, it can disrupt this balance. Research indicates that both hypertension and sudden changes in blood pressure can affect cerebral circulation. In older adults, the body's ability to regulate these changes becomes less efficient. Historically, such symptoms were often attributed to inner ear disorders or general aging. While these factors can contribute, modern studies emphasize the importance of considering cardiovascular causes. Dizziness also increases the risk of falls, which are a leading cause of injury in individuals over 60. When combined with high blood pressure, this risk becomes even more concerning. The connection between vascular stability and balance is complex, but increasingly recognized in medical research. Repeated or unexplained episodes should not be ignored, as they may reflect underlying pressure instability within the circulatory system. Vision changes, damage to delicate vessels. Vision changes can be one of the more serious yet less recognized signs of hypertension. The eyes contain a network of very small blood vessels, which are particularly sensitive to changes in blood pressure. When pressure remains elevated over time, these vessels can become damaged, leading to a condition known as hypertensive retinopathy. Symptoms may include blurred vision, difficulty focusing, or reduced visual clarity. Research in ophthalmology has shown that prolonged hypertension can lead to progressive damage to these delicate structures. Historically, eye examinations have been used as a window into overall vascular health. Changes observed in retinal blood vessels often reflect broader issues within the cardiovascular system. For older adults, vision changes are sometimes attributed to normal aging processes. However, when these changes occur suddenly or worsen over time, they may indicate underlying vascular stress. The connection between eye health and blood pressure highlights how widespread the effects of hypertension can be. Damage is not isolated, it affects multiple systems simultaneously. Recognizing visual changes as a potential warning sign is an important step in early detection. Fatigue and weakness, the body under constant load. Persistent fatigue is often dismissed as a natural part of aging. However, it can also be a sign that the body is under continuous strain. High blood pressure forces the heart to work harder than normal, increasing energy demand. Over time, this added workload can lead to reduced efficiency in circulation. When tissues and organs do not receive optimal oxygen and nutrients, fatigue begins to develop. Research has shown that individuals with hypertension often report lower energy levels and reduced physical endurance. Historically, fatigue was rarely linked directly to cardiovascular conditions, but modern understanding recognizes its connection to systemic stress within the body. For older adults, this creates a challenge. Fatigue is often normalized, making it difficult to distinguish between typical aging and underlying health issues. However, persistent or worsening fatigue may indicate that the cardiovascular system is operating under strain. This ongoing pressure can gradually reduce overall function, affecting daily activities and quality of life. The real danger when symptoms are ignored. The most significant risk of high blood pressure is not just the condition itself, but the tendency to overlook its signs. Because symptoms are often mild, inconsistent, or easily explained, they are frequently ignored. Long-term studies have shown that untreated hypertension is a leading contributor to heart disease, stroke, and kidney failure. The damage occurs gradually, affecting blood vessels, organs, and overall system function. Historically, before regular screening became common, many cases were only identified after serious complications occurred. Even today, a large percentage of individuals remain unaware of their condition. For older adults, this risk is amplified. The body becomes less resilient, and the consequences of prolonged hypertension become more severe. What makes this especially dangerous is the absence of urgency. There is no clear moment when the condition demands attention, only a series of small signals appearing over time. Recognizing these signals and taking them seriously can make a critical difference. The body rarely fails without warning. It communicates through small changes, subtle signals, and gradual shifts. High blood pressure is not always visible, but its effects are far-reaching. After 60, awareness becomes essential. Not because every symptom indicates danger, but because ignoring patterns allows risk to grow unnoticed. Understanding these signs is not about fear, but about attention. Because the earlier the signal is recognized, the greater the opportunity to protect long-term health. Final quote: "The body speaks in whispers long before it cries out in alarm."